Not known to most people, Planned Parenthood is more than prenatal care. Just a couple of months ago, the organization was in the national spotlight on its breast cancer screenings. Healthcare for transgender patients is one of the new services at Planned Parenthood, and Lupe Rodriguez, Director of Public Affairs from Planned Parenthood Marmonte, is here to talk about it. Lupe, thanks for visiting us here at Outlook Video.
Thank you for having me.
Yes, this is terrific information. Now, again, most people, when they think about Planned Parenthood, they think about one particular type of service that is offered in planning planning a child in your future, or prenatal care and all that type of thing. But there are more services available. Please tell us about that.
We provide a large breadth of services, and particularly here in the Bay Area, our affiliate, Planned Parenthood Marmonte, provides general health care for women, children, and men. So we provide a breadth of services, and as you mentioned, we also provide transgender healthcare services.
Yes, this is very, very interesting. Is this something new?
It isn't really new.
Okay.
We started providing services through our transgender health program in 2005. Okay. Our first health center that started was in Santa Cruz, and since then we've expanded the services to Sacramento and to Fresno. So we provide those services there now.
Well, when we think of Planned Parenthood, we think about women's services, but transgender people are men and women, so your services expand to men and women as well.
Exactly, yes. Exactly. You know, as I mentioned, we provide general health care, which is something people don't know. We can be a primary care provider for people. Okay. But some of the specialized services that we provide for transgender patients are hormone therapy, so male to female hormone therapy and female to male. So that's included. And then we also, at all of our health centers, provide sexual health care services.
Does one have to have health care insurance to go to Planned Parenthood and participate in the clinics and services?
You don't. You know, we do accept health insurance, but we also work with the Medicare program and Medi-Cal. Both of those programs pay for hormone therapies for transgender patients, as well as the other services that I mentioned.
I know that can be a real challenge for many people who have limited insurance coverage, or are afraid that they may not have coverage specifically for this type of services. So.
Exactly, and you know, I think additionally, all of our services are sliding scale. So if a person doesn't qualify for Medicare or Medi-Cal, and you know doesn't have other insurance, they can come to us, and we can figure out a way for them to get the care they need.
But this is pretty important for happening. Why now? Why is this now coming to the forefront? Is that because that the transgender community is now becoming more populous?
You know, that might be part of it. I think, you know, one of our philosophies at Planned Parenthood is that we respond to the needs of the community. Yeah. And we definitely, you know, have heard that we understand that there's a great need for competent, you know, respectful health care for transgender patients. And so, you know, that's what we're doing. And we're hopeful that we'll be able to expand the care. We know that in the limited places where we have the services now, we're not reaching everybody who needs the care. So we're working on expanding our services, and we're also working with a fellow Planned Parenthood affiliate that provide services in Walnut Creek area in San Francisco to open services there.
So you said, once again, let's make sure that our viewers understand this as well, that there is in Walnut Creek this particular type of services which is coming soon, yes?
Yes, coming in June of 2012 through our sister affiliate, Shasta Pacific. And then again, we provide services at our health center in Santa Cruz, in Sacramento, and in Fresno. But again, you know, patients can come to our health centers and expect, transgender individuals can come to our health centers and expect that they'll receive competent sexual health care and primary care. So to any of the health centers.
And I think you also said it very nicely just earlier, and respectful care.
Yes.
Yes.
Absolutely. I think that's a really important part of the work that we're doing, and you know, again, providing specialized services in some of the places where we can, but ensuring that everywhere where we provide services in 33 health centers around the state, in Northern Nevada, that we provide, you know, the most respectful and competent health care for everybody.
Wow, Lupe, this is wonderful news, and I'm so glad you're here to share it with us today. Thank you for being with Outlook Video.
Thank you for having me.
Planned Parenthood offices are located all around the Bay Area, and for specific information, you can go to plannedparenthood.org or call them at 1-800-230-PLAN. Lupe, again, thank you so much for joining us. You've been a wealth of information to our viewers, and we appreciate you coming in.
Thanks for having me. I really appreciate the opportunity.
Fasten your seatbelts. We go bungee jumping next with Paul Falworth.
We love to get mail from you. Email us at comments@outlookvideo.org.
To contact us by phone, call 408-293-3040, extension 205.
Visit our website at outlookvideo.org.
Subscribe to our YouTube channel at youtube.com/OutlookVideo.
And connect with us at facebook.com/OutlookVideo.